Have you ever noticed a strange smell when talking to someone with cavities? That distinctive odor is not just bad breath. It is a warning sign from specific bacteria living inside decayed teeth. Today, I will show you exactly which 3 bacteria create this smell and what your conversation partner actually detects when you speak. Bacteria number 1. Let me introduce you to bacteria number 1. Porphyromonas gingivalis. This anaerobic bacteria thrives deep inside cavity holes where oxygen cannot reach. It feeds on blood and tissue proteins in your gums. As it digests these proteins, it produces hydrogen sulfide gas. This is the same compound that gives rotten eggs their distinctive smell. When cavities are deep enough, colonies of Porphyromonas gingivalis can number in the billions, constantly releasing this sulfur gas into your mouth. Bacteria number 2 is Fusobacterium nucleatum. This rod-shaped bacteria forms dense colonies specifically in decayed tooth tissue. It acts like a bridge, helping other harmful bacteria attach to your teeth. Fusobacterium breaks down amino acids and releases multiple sulfur compounds, including methylmercaptan. This chemical smells like rotting cabbage or decay. Dentists can often detect this specific odor when examining deep cavities. The smell indicates active bacterial infection destroying your tooth structure from the inside. Engagement moment. Now, I want to hear from you. Have you ever encountered someone with noticeable bad breath from cavities? Or maybe you experienced this yourself and did not realize what was causing it. Write in the comments below about your experience. What did the smell remind you of? How did you handle the situation? Your stories help others recognize the warning signs. Bacteria number 3. The third culprit is Prevotella intermedia. This bacteria specializes in breaking down proteins from dead cells and food particles trapped in cavity holes. As it digests these proteins, it releases a putrid, rotting odor. Prevotella intermedia multiplies rapidly in the acidic environment that cavities create. The deeper the cavity, the more acidic the environment becomes, and the faster this bacteria reproduces. This creates a vicious cycle of decay and smell. The science of smell. Together, these 3 bacteria produce what scientists call volatile sulfur compounds, or VSCs. The main culprits are hydrogen sulfide, which smells like rotten eggs, methylmercaptan, which smells like rotting cabbage, and dimethyl sulfide, which has a sweet but unpleasant odor. These are microscopic molecules, but they are incredibly potent. When you speak, breathe, or even just open your mouth, these volatile compounds escape and travel through the air. Your conversation partner's nose can detect these odor molecules even from several feet away. Studies show that people can detect hydrogen sulfide at concentrations as low as 0.5 parts per billion. The solution. Here is the good news. When a dentist treats your cavity by removing the decayed tissue and filling the hole, they physically remove the bacteria colonies. Without their home in the cavity, these bacteria cannot survive in large numbers. The smell disappears completely within days after proper treatment. Prevention is even better. Regular brushing, flossing, and dental checkups stop cavities from forming in the first place. No cavities means no home for these smell-producing bacteria. If you or someone you know has persistent bad breath, it could be a sign of untreated cavities. See a dentist for a proper examination. Subscribe to Health Science 3D to learn more about oral health, bacteria, and how to keep your mouth healthy. I create detailed 3D animations that show you exactly what is happening inside your body. Hit the bell icon so you never miss an upload.